Okay, let's make a start then. So good afternoon, everyone. I hope you're all doing well, and thank you for attending today's webinar as we discuss the upcoming changes to our LTC annual recall system. My name is Charmaine Jackson. I head up the training team for Ardens, and I'm also joined by my colleague Nathan, who you can see on screen, and Nathan is one of our training specialist leads. Now, the response to this webinar or webinars has been absolutely huge. So we are expecting quite a lot of numbers on here today. Really great to see. And it also shows the importance of you wanting to maintain and improve your recall process within your organisation. Still very much a hot topic for us in primary care. So just so everyone knows what to expect out of this webinar today, this is very much a high-level overview of our updated resources across both EMIS and System 1. So EMIS practices, you will see an updated system and you'll also see a new approach to LTC recall. While System 1 practices, you're probably quite used to the approach now, but you will see some enhancements and improvements to your resources. Now, because this is a top-level overview today, we will be providing further system-specific webinars in April time. So we'll make sure we share the details of those, but those are going to go into more full detail on how you actually use the resources. We're going to provide you with a full walkthrough, so please do bear that in mind, and we will share details on how you can register onto those webinars. Now, in terms of housekeeping, as I mentioned, we are expecting quite a few numbers today. So we want to make sure that all of you are getting the most out of this webinar as much as possible. You'll notice that your microphone is disabled and that will remain all the way throughout the webinar. However, if you do have any questions that you would like to answer, then please use the Q&A section. So it might be worth, if you're new to our webinars, just take a look to see where that Q&A option is. We're also going to do quite a few poll questions as well to get an idea of who we have in the room. And the session has been scheduled to 1 hour, and we will try and stick to that as much as possible, won't we, Nathan? Normally with topics like this and with so many questions, they do tend to go over, but we will try and stick to it as much as possible. Please do not worry about taking loads and loads of notes. The session is going to be recorded. We will make sure that we share it with everyone that's registered on the webinar today, and we will make it available on our website as well. Now, in terms of what we're going to be covering today, and you can see it on screen there, we're pretty much going to be doing it in this order as well. So we're going to be talking about the benefits of having an LTC recall system and then explaining the changes that we are making and why we are making those changes. We're then going to go through the process so that you understand the stages of each part of the recall process and the new approach that we're taking. And then we're going to discuss the next steps that you can take after this webinar and also talk about the ongoing training and support that we have available for you. There'll be plenty of training and support for you to tap into. Now, I probably think, Nathan, it's probably a good idea now to just fire off some poll questions before we go even further. It'd be really good to understand if you are an EMIS practice, if you're a System 1 practice, perhaps you cover both of them. So what I'm going to do is I'm just going to fire off a question. We've got nearly 500 people in the room here. So I'm just going to fire off this question, just waiting for my screen to load. There we go. And I'm just going to launch this question here. Please do tell us, what system are you currently using? Is it EMIS Web? Is it System 1? Maybe you're using both of them, or maybe none at all. It'd be really good if you can give us an answer to that, and we can keep an eye on the chat. Perfect. So far we've got 56% of EMIS practices, Nathan, and then we've got 41% of System 1, 2% are using both, and everyone is using something, which is really good. So we've got quite a balance between our systems, which is great. Next question, we want to understand whether or not you're currently using our Ardens LTC recall system. Yes, no. If it's a no, or if you're not sure, then that's absolutely fine because you're going to get a good idea of how you can actually use it going forward. So I'm just going to launch that question now and just give us a yes or a no. Would be brilliant. And then again, that just gives us a good understanding of who we have in the room. What are we saying there? So we got 60% who are using our system already. Brilliant, thank you very much. And 29% who are not at the moment. Hopefully that will all change by the end of the webinar. Okay, next slide, please, Nathan.
Yeah, no problem.
Thank you. So starting from the beginning, really, and providing you with a little bit of context. Now, we know that effective management of long-term condition is a core responsibility within primary care. And we also know that in NHS England do highlight the fact that we need to have a reliable and a structured recall process in place. So not only does that ensure that patients receive timely care, it also helps us with early prevention, like we know, workforce planning, and it supports reaching achievements such as QoF indicators and your local commission services. So with all of this in mind, we at Ardens must always be ensuring that we are evolving our solution so it is supporting you as much as possible. Next slide, please, Nathan. So therefore, following customer feedback and also preparing for future changes or changes that are coming, such as NHS Notify, a lot of you would be aware of that, and also automated recalls, we have updated our recall system to support you with a whole pathway approach to long-term condition management. So that's everything from inviting to reviewing to monitoring. We want to support you every step of the way. And what you'll see is the changes, particularly for the EMIS practices, you'll see that the changes will expand beyond just QoF. We're also introducing best practice conditions, which Nathan will speak to you about shortly as well. We want to further streamline your process. We want to make it as easy as possible for you. And we've also enhanced our templates to incorporate risk stratification. If you joined our webinar a few weeks ago, we did a webinar all around risk stratification. We also know it's a hot topic as well. So therefore, we want to make sure we're making that opportunity for you when you're capturing your long-term condition information. So in terms of when it will be changing, so if we just go to the next slide, as a reminder, so for System 1 practices, the overall approach will stay the same. So for you guys, it's just enhancements and improvements that will happen for you, and that will be replaced from April time. For EMIS practices, it will be a new folder structure. You will get new templates, and these will all be available from early April onwards. Now, for EMIS practices, by no means are we expecting you to switch overnight. We appreciate that this is, a big area. We want to help you get it right as much as possible. So we're going to keep the current system that you're currently using at the moment. We're going to keep that in place right up until April next year. So that will give you a whole year to really learn the system, to be able to switch over when it's more appropriate for you. And we will make sure that we support you with that when you decide that you do want to do that. And I'll talk about training and support near the end of the session. So if we now have a look at the actual process, and then Nathan's going to go into detail about what that process looks like and each stage. So remembering we're looking at the whole long-term condition pathway approach. So what that will mean is we're supporting you with the planning stage. We're helping you to look ahead, to plan your clinics and your resources. We're also helping you with notifying your patients, identifying the right cohort of patients so that you can invite them in at the right time, understanding who needs a visit, who just needs an invite. We're helping you with assessing as well. So we want to support your healthcare assistants or appropriate staff, depending on how your organisation works, in gathering all of the initial tests that they need to. We then want to help your clinicians. We want to give them a chance to review all of the notes, make a decision on whether or not the patient needs an extra phone call or maybe perhaps a message or perhaps an appointment. Remember, at the same time, we want to save on patients coming back and forth multiple times to the organisation. So we want to help you with that as well. And we also want to help you with monitoring the activity throughout the year. How are you doing? Where do you need to improve? What is still outstanding? So we're helping you with that too. So the great thing about this process, as you know, is it really does involve pretty much everyone in the practice, doesn't it? From your management team who are going to be planning the clinics and the timings, like I mentioned, to your admin team who are inviting your patients, from your reception team understanding what appointments need to be booked for the patients, to your healthcare assistants collecting that data, doing those blood tests, from your clinicians reviewing the notes and making the best decision around that patient's care, and then and looping back to your management team as well, and helping them to understand what the progress is. So this is just something that you need to bear in mind, particularly when it comes to training, particularly when it comes to learning the new system. It's not just that one person who carries it for everyone. We need to be thinking about all of the practice staff who'll be involved in this, and hopefully as Nathan goes through the steps now, it'll give you a good understanding of what staff member needs to be doing what. So I'm going to stop.
Real.
That's my introduction down. I'm going to pass you over to Nathan now.
Thanks, Charmaine. Excellent. So yeah, so kind of we're going to do the flow of this process using that exact flow that we've seen here. So I'm going to cover each of these sections and just give that high level overview of exactly what the resources are going to look like and a work through. So starting with plan then. So we've built resources to kind of help your management team, like Charmaine said, with kind of looking ahead at kind of how is this going to work for the year, understanding kind of how many patients fall into kind of each condition. Do we need certain appointments available for those, for those conditions every month, and just kind of setting up your clinics so you know that you've got the capacity to do those reviews. So they're kind of useful reports. And I'll show you what that looks like. Now, the first thing to say about the planning is actually, well, what conditions does these things include? So it's a bit of a change kind of what you did before. We were mentioning about this best practice, but what we're going to do is we're going to allow practices to choose one or the other. So practices will still just be able to invite for QOF conditions only. So that's your traditional QOF conditions that you get paid for QOF, obviously. Now, obviously, over the years, QOF has kind of been getting a bit smaller, and obviously they will be changing in April. So we also have the option of doing QOF and best practice conditions. And in essence, this is like your gold standard. And as you can see on the screen there, we've kind of listed all of those conditions that would be included in the QOF and best practice. So it will be very easy to choose. You'll have a folder for one or the other. The whole process itself will be the same, whichever one you choose. In essence, one's just going to be inviting more patients in than the other. But as you can see, those are all of the conditions if you were to choose the QOF and best practice. There are a couple of nuances between the two as well with some of those existing conditions. So, for example, asthma patients is always a good example that I like to show. If you chose the QOF conditions only, and you invited patients with just those conditions, that would only include patients on your asthma register, and the asthma register is defined as anyone, I think it's over the age of 5, that have had an inhaler issued to them in the last year. If you chose the QOF and best practice conditions, that would include any patient with a current diagnosis of asthma, regardless of if they have had that inhaler issued to them in the last year or not. And we will have things to help you with that with regards to planning forward. But it would just capture those patients that, maybe they were diagnosed 18 months, they last had their inhaler 18 months ago, for example. They're probably still an asthma patient because they don't have that asthma resolve code. They would be called in for those reviews as well. So it's just a couple of nuances. We will get into that nitty gritty when we do our practice specific, our system specific webinars. So please don't worry too much about that, but there will be those nuances. But other than that, is either QOF or QOF and best practice. Now, what will that look like? So we've done some screenshots of the folder structure. Now, as you see, you'll have kind of like the plan folders, and we have the reports that are basically just going to show practices, the management team, how many patients fall into each of those conditions. So as you can see on my screen, the actual top one will have all. So you'd see kind of like your total population of patients that have one of those conditions, but then we will break it down by the various kind of conditions like atrial fibrillation, heart failure, etc. Again, you're going to be doing the invites elsewhere, but you can use these reports just to check, how many patients fall into these, and you can also use it to kind of check if patients are in those registers. So it's just a general idea of how many patients we'll be calling in. So those reports will help you with that. Now, we also, because you might be sitting there thinking, well, we currently don't, recall for that specific condition, or maybe you've got another mechanism in how you recall those patients. So we will give you the option of adding specific codes to those patients that will take them off the invite reports that we have built. So again, we will cover that in more detail on the practice specific webinar. So please don't worry about what those codes are now, but we will provide some reports in the exception folders that would show those patients that have that code added to them. So if you ever need to review them and do whatever to add them back on, then you can do that. But it's more just knowing that you would be able to run some reports on a certain condition and go, actually, we don't want to call these guys in, we're going to do it separately, add the code, and that would take them off. So you have those folders as well for planning ahead. And the other thing to think about is, so this system is relying on a recall month. Now, this will make more sense in a minute when I talk about the invites, but by definition, what is going to happen is we are going to divide your patients up by their birth month. Now, the reports I'm showing you there is we will just have reports that will just show how many patients fall into each birth month. And again, that would allow you to kind of plan ahead. So maybe at your practice, maybe February, there are more patients with a birth month for February than there are December. So you can plan ahead and just make sure that you've got that appointment capacity, and those reports will help you with that. Now, again, it might be one of those things that you have certain patients that are tricky or they don't want to come in on their birth month. We will also give you the mechanism in which you can add something to their record to move them to another recall month. So we tend to talk about that birth month is the recall, and I imagine that most of your patients will be their birth month, but we like to use the kind of the term recall month because there will be your patient, if you add that code or the diary recall, if you're using EMIS, then it would move them to that month. And again, we will cover that when we look at those practice specific, but again, just knowing that you can kind of plan ahead using those reports there. And then kind of another kind of review before reports that you can use for planning ahead. I liken this to some kind of housekeeping reports that you can use. So essentially what practice can do is look at these reports and I guess identify certain patients that you might not want to recall in for other means, or do we need to do something to their care before we start doing our invites? Now, again, we'll go into more detail at another time, but an example of one of the ones here is you can see the top one on here where we've got change the recall month as review or default in Q1, but recall month is Q4, and we've also got one for Q4, but recall month is Q1. So you might wonder what we mean by that, but essentially my birthday's in May. If for some reason I only have my reviews completed in February because it was delayed throughout the year, my review would have been done, say, last month. But because my birth month is in May, I might then get an invite next month for the new fiscal year. And I might say, well, why are you only inviting me in? Because I've only just come in last month. So it's those sorts of reports that will help you identify those patients and decide what you want to do with them. Yeah, let's call them in, or should we do something else to, move their recall month to another month? So then we're spreading out over a year. So it's those sorts of reports that will help you kind of make sure that you're not inviting patients in at the wrong time or patients that don't need to come in. So again, a whole load of housekeeping reports that you can run whenever, not just before. And just one last little question some people might have. You can migrate onto this system, if you're using kind of like another mechanism, you can migrate onto this at any point. We will provide training and help you with that. Again, a lot of this is kind of practice specific with your nuances of how you work. So rest assured at the end, we will talk about training and things like that, but we will provide some reports as well that will help you just identifying, have these codes been used elsewhere and just making sure that everything's clean for starting this process. But again, we can cover that when we give you separate training. So that's kind of like the planning bit. It's kind of just looking ahead. What numbers have I got? Is there anything I need to clear up before I actually send my invites? The majority of you that actually manage your recalls will be using the notify section of this. And that is essentially sending your invites and seeing who needs a visit. So with that in mind, then what we have done is in the notify section of the reports that we are going to provide you, we have basically the best way I describe it is you've got your cohort of all of your patients that have one of the conditions that you want to invite in for, whether it's QOF or QOF and best practice. And what we've done is we have then divided that population by 12, which will be their recall month. So again, we talked about that already. And the idea is you would then be inviting those patients in. So we could now maybe start inviting for your April birthdays for the new year or April recall month. And we have those reports that would basically identify who those patients are. Now, these reports are based off of coding and codes in the notes. So, and you know, we've stated it on here. So it's looking at their month of recall. And it's just looking at a couple of codes, and this will make more sense when we look at the reviewing part. But if the patients don't have a code of their long-term condition initial assessment or their annual review being completed, then they would appear on the first invite reports. And basically you can also extract that list of patients out, and then you could use, if you're using system 1, the communications annex in system 1, or you can export it into a third-party software to text or an AccuRx, or obviously we've got NHS Notify coming as well. So they will all work with those. You can obviously, every practice is different, but the reports will allow you to do that. And in essence, what you're doing is you're going, right, all these patients need a recall in April, and then you are going to code the invite code to say they have been invited. And then that would move them on to a second invite and then a third invite. So it's very much a 1, 2, 3 invite process. And it all works off of obviously adding that invite code to their notes. Now, not only that, but we actually break down those invites into segments to kind of help you manage them if you wish, because it's all very well going, these are all of the patients that we need to invite in, but there might be slight nuances, and rather than sending bulk invites to all those patients, you might want to separate them out and send specific invites like that. So what we will allow you to do is we will, and again, you can see on the screen here, you know, how we've separated them out. So we have separate reports just for your asthma patients, and they don't have any other condition. So the idea there is we could almost clear those guys because they're quite easy to deal with. They've only got asthma. They probably don't, you know, they don't have anything else going on. We could send them a questionnaire, contact them, deal with them separately, because we might not necessarily have to invite them in to have their reviews done. Maybe it's something we can do remotely. So we separate those patients out and you can invite them separately. Not only that, we've got the consider method. So we have separate reports. So if a patient has one of those conditions, but also has end of life, learning disability, dementia, or they're under 16, or some sort of reasonable adjustment, we probably wouldn't want to send them a generic invite, because for some reason, who are we actually sending it to? Will they understand it? Do we need to call them in? So that would allow you to separate those patients out and decide how you want to invite them, and then invite them how you want, whether it's text or phone or whoever. And then we kind of have everyone else, which again, I always say this for want of a better word, but it is your normal patients, and they don't require any other kind of sensitivity with regards to inviting them. So we could, in theory, just invite the rest of everyone else. So again, just allows you to manage it in a bit more granular way, but it's very easy. The patients are there and you can do it like that. There's one other thing that you can do, because at this point you might think, well, I might want to know what conditions these patients have. So we will also give you the facility to see, out of all those patients in the recall month of April, say, what conditions do they have? Because maybe you might want to invite, yes, we've done the asthma only, but maybe the diabetics, we might want to focus on them first, or whatever. So we will also give you that mechanism to enable you to see exactly what conditions those patients have. And again, everyone works differently. Some practices don't need to do that. They just like to do the bulk invites. Others might think, yes, we want to do it that way. So it is flexible. And again, that is the sort of thing that we will be able to cover on the practice specific, so the system specific webinars that we're doing. So yes, that would help you with those ones. And then just so you know as well, anyone that is in a care home or coded as being housebound, they are separated out from those invite reports that I was just showing you. and they will sit in their own folder. So practices can go, right, those are all my patients that are in a care home that have one of those conditions, and then you could go out and do a visit and decide how you want to approach those reviews, because you wouldn't necessarily be inviting them because they can't come in. So again, they are separated out for you to manage how you want. And in theory, that is where you do your invites, and you'd invite and you code, and hopefully they'll answer and they'll come on in. And so what we do is we're now going to move on to the assessment stage. So this is kind of the bit where we're actually interacting with the patient, and they're probably coming into your surgery to actually have their reviews or that initial assessment. So the idea is you might send a questionnaire out to those patients. Maybe it's an asthma questionnaire, or however you want to send it. And that again could be using third-party software. They would then have their initial assessment where we review those answers, get any other bits of information in about that patient, and do their blood test. So it's that initial appointment. Usually might be your HCA, but again, every practice is different. You know, phlebotomist, HCA, whoever's doing that, they can gather that information at that initial stage and get as much as they can done then. So with that in mind then, I mentioned about the questionnaires. So in System 1, we have built some questionnaires that you can use. Some of you might already be doing this, and you can send those out with your invites or when the patient calls up. There's lots of different ways you could do that. And again, I believe, Charmaine, again, correct me if I'm wrong, but in EMIS, they could use that in the third-party software to send those
Yeah, they would
questionnaires.
normally do that process via third party, so it'd be no different.
Yeah, perfect. And the idea is, again, you know, you can use those questionnaires to go, well, why don't we try and gather the information before the patients even come in? So again, it's all seamlessly integrated into that system. And then the patient would, you know, come into the surgery and have their initial assessment. And then we have built templates enabling you to do that in a nice, concise way. These templates will be, you know, specific about the patient's conditions as well, and it would have all of that kind of information that the HCA or whoever is doing that initial assessment would be able to kind of gather. And again, remember, this is all based on best practice, nice guidance. You know, we can see what will they need to have done, and then we can capture that information as much as we can. And again, this all depends on skill sets and what you do at your practice, but the templates will have everything that you need on them to code that. And you'll notice as well, you know, with regards to kind of like the red traffic lights or green, you know, depending on their answers, it's going to suggest kind of next steps. So again, based on best practice, you know, so the pulse is regular, might be fine. If it flags up as abnormal, then we know that that probably needs to be cascaded elsewhere, or, you know, get some sort of kind of, you know, other intervention. So the templates are going to have all that information in them, and there will be well-being questions and, you know, all sorts of things. You know, it might just be gathering their blood pressures and, you know, weights and heights and giving lifestyle advice, but the templates will have everything in one place where you can gather that information. And it might be at this stage you're looking at what they filled out on the questionnaire. Is there anything else we need to add? So the templates will seamlessly kind of show that. And not only that, it will also tell us exactly what bloods they need to do. So again, I think this is a bit different, isn't it? We've got the blood test analyzer in here, Charmaine.
Yeah, we do. Yeah, so you're probably used to our pink box alert with the blood test due analyzer, which tells you what blood tests are upcoming for the patient. But if you notice there on the template, we've incorporated that in the template for you. So your healthcare assistant will know exactly what's coming up, which is great because it means it's just another place to look, really. So that will be a bit different. And also note to the EMIS template as well, it will still be smart working. So the pages will only come up if the patient has that particular condition. So you're not losing that at all.
Yeah, so that, I guess the idea is at this point, you know, whichever system you're using, the template you bring up just has everything you need in one place, and you're not getting distracted by other conditions or do I need to do this and that. Is purely for that particular patient. And then we can just do our blood tests as we normally would. You know, none of that's different. It's just how you look at that information, and you can code it and do everything as you normally would. So again, just, you know, one place where you can get that assessment done. And then essentially what would happen is, once we've done everything we can up to this point, we've checked the questionnaires, we've coded everything that I can physically do at this point, I've done all their bloods, we would probably send the patient home, and, you know, awaiting their results. So as part of that template, there will be a tick box that you would tick, and that is an important aspect of this. So you tick it, it's almost basically to say the initial assessment's been done. And that code is important because what it's going to do is it's going to take those patients off of those invite reports that I showed you earlier, because those invite reports are looking at patients that haven't come in yet. Well, now they've come in, tick the box. That acts as in a way, your recall. We're not recall them back. We need to follow up, but it's almost ticking to say, I've done everything I can. It's over to the person now reviewing those notes. So again, but there'll be a tip, but really, really easy to do. So it's kind of all quite slick and there to kind of as part of the process. And that kind of then wraps up that assessment stage, because we've done the bloods, captured as much as we can. What would then happen is we would need to follow up. So what we've done is we've built some reports that will identify all of those patients that were seen by the HCA or whoever saw them in that initial assessment. They basically three days, I'm not going to say they don't disappear, but for 3 days, after 3 days of them having that initial assessment, they will drop onto the reports. And it's 3 days because that's roughly how long it would take for the bloods to come back. So it means that you're not running reports and seeing a list of patients that you can't action yet because their bloods aren't back. So after 3 days, you can, in theory, do a notes review and then decide your actions dependent on what the results were and what was done in that initial appointment. So, and then once you've done that, follow up, and then you would complete the annual review. So again, what will that look like? That's the workflow, but what will that look like? So there will then be a review folder on your reports. And then these are divided up. In essence, there, as you can see, we will have a report that will basically say for review all. And essentially what it's doing is going, right, these patients had their initial assessment more than 3 days ago. Let's do a follow-up. So we can do kind of like a notes review, and you could choose it as all, or as you can see on mine, we break it down by each condition. So again, we allow practice to do that how they want. It might be that I'm just going to run, it's my I'm duty doctor today, I'm going to run through this list, or I deal with, the cardiovascular patients, I'm going to deal with the cardiovascular patients. So again, we give you the choice depending on how your practice works. But the idea is you'll have your list of patients and you'll be able to go in, look at the template, and bring up that long-term condition template again that we are going to build you. And in that template, again, it's essentially going to show us what needs to be coded. Obviously, you're going to see anything that's already been recorded in that initial assessment. We would be able to review the bloods as well, what was done with regards to the bloods, and we can capture anything that is missing. And I guess the thinking here is you don't need to do this with the patient. If you're doing that kind of digital kind of notes review, you can look at this, look at the blood results, and then using the templates. And remember, this is all based on best practice and nice guidance. We've got our traffic light system as well. So, depending on what I put in, it's going to tell me is that good, moderate, or poor control. And then dependent on that, is it controlled, or do we need urgent action? We can decide if we're going to call that patient in, or maybe we just send them a text to say, everything's fine, bloods are fine, see you next year. That's the best case scenario. Obviously, not every patient's going to be like that, but the templates are going to allow us to view that information in an easy way to decide our next steps. Now, we've also built, you can get a bit more granular with this because that was in general, but we've also got the ability to maybe just pull off ones that have only got one long-term condition. So, do they just have atrial fibrillation? Do they just have diabetes? So, and again, this will all depend on your workflows, and we can discuss this with you when we give you training and do the system specific, I keep saying practice, the system specific webinars, but we could go, actually, I'm only interested in my asthma patients or my mental health patients, and you could pick those off. So again, depending on how you work, we've given you those options. And again, we've even broken it down to the groups. So, is it one of the kind of like, cardiovascular, renal, or metabolic conditions? Is it one of the mental health conditions, or is it one of the respiratory conditions? So maybe you've got specialists who work in that whole area. They could pick off those patients that had their initial assessment, review them. Do I need to call them in, and then use the template to do the review as well? So again, it just gives you that, I guess, different approaches depending on how your practice works. And then basically, once you've done everything, there will then be a tick box on the last bit of the template to say, I have done everything. And what that will do is it will add the full, LTC review completed code. And by ticking that, it would remove it from those review reports that I was just showing, or these review reports, because you don't want them hanging around there once they've been dealt with. So, to strip the whole system back, you are literally inviting and coding to say you've invited them. You're then coding to say they've had their initial assessment, which moves them onto the review reports. And then once you've done everything, you add one final code, which then removes them from those review reports. So, when you think of it like that, it's a very, very easy process. But what we have done is we've built some safety nets in there as well. So again, we've got some reports that would essentially say, they had their initial assessment, but it's been 2 to 3 months since that was coded and no one's completed off the reviews. Or maybe it was more than 3 months ago. So again, practices can look at those reports and go, well, hang on a sec, why has no one closed this off? Do we need to intervene with this patient? Now, you'd hope if you keep on top of things, you'd never have anyone in them, but it's really good practice to kind of run those as well. So, just allows you to kind of make sure that you're on top of everything. So I'm hoping this is making sense. And then what we're doing is we're going to move on to kind of the evaluation stage. So we've done our reviews, we can evaluate. So again, some useful reports that, these are dead easy, to be honest. They're essentially saying, how many annual reviews did we complete last month? And you can do it by month, you can do it by condition, etc. So, you can get this information, see how many you did, and just keep on, kind of evaluate that you're doing everything as you should be, and you're not missing any patients out. So you can kind of see how this process is working for you, especially when you start it. So that would just be in the evaluate reports. And then we will also provide you with some useful reports to help you manage kind of adding your personalized care adjustments to those patients. So, making sure that anyone with outstanding QOF, you're not, going to miss them, and that personalized care adjustment is going to be added because of the invites they've had, etc. So we've even got reports to help you with that towards the end of the year or whenever. And again, it's the sort of thing that we will go into in more detail when we do these other webinars. But we factor those things in as well. And I think lastly, just with that process, is just to explain, obviously, don't forget, you've got your Ardens Manager dashboards as well, and it's a really, really useful place that you can kind of jump in and look at those registers. And this is your QOF work essentially, isn't it, that you're doing and anything else? So the dashboards would pick all of those up. So our diabetes dashboard, what sorts of HbA1cs have been coded, how many diagnoses, but how many reviews have we done, what's missing, and we can really dive into that information. And kind of look at specific safety alerts as well for their medicines. Again, should we be actioning on what medications that they're taking based off their conditions? And we'll even have case finder reports that would enable you to look for patients that aren't on your registers. This is standard stuff. You don't have to use this as part of the long-term condition review. You can use this whenever, but it will work hand in hand with the long-term condition reviews, because a lot of this, our performance indicators, how we do with our reviews. And because in Ardens Manager, you can dive in and look at more data than you can in the clinical systems, you can start benchmarking this and looking at trends. Have we had an uptake in that specific indicator since we've been using the Ardens long-term condition reviews or anything like that? So you can really use it to kind of see how you're performing as a practice. So some of you might be using that, some of you might not be. Obviously this is kind of separate to the long-term condition review, but it's just a really another good way of looking at how you could kind of process that data, I guess. Now, I think, essentially that is a very, very whistle-stop tour. But yeah, I guess, I don't know.
Probably need a glass of water. Do you need a glass of water now?
Probably.
Thank you. That was really good. And actually, we've had some really good questions come through the Q&A. It's just really getting people thinking about how it's going to work in their practice. It's been really engaging. Please don't worry. We will get around to all of your questions. Appreciate there's a lot of people on here, a lot of questions that are being answered, which is great. We probably will follow up with a FAQ for all of the webinars that we do. Just picking up on a few points though, remember for EMIS practices, the current system will be with you until April 2027. So you've got it for the whole year while you transition over to the new one. The multi-morbidity templates will stay there as well until you're fully ready and switched over. But by you using the LTC templates, hopefully that will give you, not even hopefully, I know it will give you everything that you would need for this process. We had a few people mention, Nathan, whether care home and housebound patients will be included, and what do we do with the vulnerable patients, which I think you picked up really nicely. So hopefully that answers your question there. And yeah, interim reviews, of course, we will be considering interim reviews as well. So watch this space, and we'll cover that in more detail in the System Pacific webinar. And yeah, just lots of questions that we will get back to you all. So thank you. Keep posting them. It's really good to see some of these. So in terms of where do we go from here? A lot of information that you've taken in from this webinar today, all good information, but really you now need to reflect on the context, the approach that we're bringing to you, and working out how it will work best for you and your team and your practice in general. We do have some really good support articles which gives you just a top level overview of everything that Nathan has discussed today. So it's worth having a read of those. And we will provide more support articles to give you a breakdown of how to do all of these different processes. So we will make sure that you're covered, so don't worry. The resources, as mentioned, will be available from early April. We will inform you when they will be ready. It will just be automatic in your system. You don't need to be pulling them in at all. We'll sort that all out for you. So we'll let you know when that happens. And I'm going to keep drumming in training, because training is my favourite thing. But please do consider training for all of your practices, staff who will be involved in this process. Plan the time in, make sure that they attend the training, and we're going to talk about training and webinars in a minute, so I'll leave it there. And for EMIS practices, it's now really thinking about reviewing the new setup when it's available for you, setting it up, and agreeing a time when you will be switching over. And remember, we will help you with that as much as possible. Do you want to just go to the next slide, please, Nathan? So training and support. Lots of training and support. So I mentioned at the very beginning, Nathan mentioned it a few times throughout the webinar today, that there will be System Pacific webinars. So we had EMIS and System 1 practices all on one webinar today, which is great. But now when we go into the nitty gritty of it and we give you a full walkthrough, that has to be done separately to give you that time. So we'll do the EMIS one on the 8th, and we'll do the System 1 one on the 9th. If we need to have more, we'll put more in. What we're also going to do is hold the webinar every 2 months. So you've got an opportunity throughout the year to keep coming back on if you need to. We're also going to target you with practice level training in which we can come and see you in person if we've got a trainer nearby, or we would do it remotely. So there'll be plenty of training support throughout the year, and just get in contact with us if you need more training. Remember, training is free as part of being an Ardens customer. That's the beauty of it. So please do make sure that you do book in for some training. Got a very dedicated support team as well. Great support team. They're available Monday to Friday to be able to answer any queries that you may have. We will make sure we share the support email address in, it's not on the slide, probably put that on for tomorrow, but we'll put the support email address in the Q&A for you so that you've got that as well. And I think that just leaves us to the last slide, which is feedback. Really important. So please scan that QR code, give us a feedback on the recall system, what you think about it, how we can help you more. We always want to listen out for feedback, so please do make sure you take the time to do that, and we will make sure we review that as well. I think that's everything, Nathan, isn't it? Unless there's anything else you want to cover.
No, I think you've already mentioned it, but we always bang on about training because these sorts of processes, every practice is different. So we always just like to say, because this is such a high level overview, please know when you book that in, we can have that conversation with you about how does it work for you, and we can give you hints and tips and things. So just please know, you might think, well, my practice is a bit different. We're happy to have that chat with you with regards to this. But other than that, I think that was it really. Hopefully it's given you a bit of food for thought.
Yep. we will be in touch. Make sure you go onto those webinars. We will make sure that we share the FAQ. We are repeating this tomorrow, and we are repeating it on Wednesday. Oh, we've got some nice emojis coming up. That's always a good sign. We have got some more webinars coming up, but they are fully booked. They've been very, very popular. So we will make sure that we share the recording with you. I know that there's some hands going up, but if you just pop your question in the Q&A and we'll get back to you as soon as possible. But thank you so much, Nathan. Thank you. Really good.
Oh, yeah, you're welcome. I hope it was
really good. Thank you, everyone. And
thank you.
We'll see you on the next ones. Thanks very much. Just to come out of the meeting, by the way, it's just the red leave button. Just post your questions in the Q&A. Keep doing that. We'll get back to you as soon as possible. But yeah, it's just a red leave button to leave the meeting. And we look forward to seeing you in the next one and helping you as much as possible. Thank you very much, and bye for now.